I conceived the baby the best way I could. I did like a sheet roll and poured it all the way to the bathtub and left it in the bathtub the best I could. Got in
Was
there.
she in your home or?
She was in my apartment, and gave the water the way I would like it, put suds in it, and I turned down the lights, put candles in there with some music. I told her she was at the Bahamas to chill out, relax.
Got an image.
And let her soak, and I went in there, scrubbed her, and bathed her, and she looked at me, she said, Linda, I haven't had a bath in 6 years.
Yeah. Yeah, but see,
She
we,
had tears in her eyes, and I mean, I choked.
yes, that's a good story to share, because that's what goes on. No, that's what goes on. We don't know what goes on in our world. We don't know what's happening to our next door neighbor, do we? I'm telling you, you don't know, because we don't get involved. Do you see, you guys, and I'm pushing that envelope of service, engagement, responsibility to help one another. We don't know. And the nails, do you see, you can look at these nails and say, man, this could be a septic situation, couldn't it?
Fingernails all over here.
Yeah. Oh, I didn't put fingernails, but I could have. All I had to do was Google it.
Think of how they're growing into the skin.
And they're digging, and they are already got vascular insufficiency. You see, they already have vascular. So what happens is they get septic. They're septic. They come into the hospital septic. They come in code 3 from their home where they live alone. Family member, a postman, the post office, the mailman found them. See? We don't know how many people are in this state. We just don't know. But you get on the phone with the primary doctor saying, we need a podiatrist and we need them now. And it's a job, let me tell you, this is a challenge for the podiatrist. This is not our job. We are not, this is a field of its own for physicians. This is a specialty field. It is. That. You need to see that, because you are going to see it. You're going to unfortunately see it when you admit patients on your floors in the hospital. Now, nursing homes, they're not going to let this, they're going to have a podiatrist taking care of this patient. Because this state come in, they shut them down. They can't leave something like this. But that nurse can't be responsible for that care. You cannot, you are not. That's above our scope of practice. This requires a specialized physician. If you can see what I'm saying, y'all see that, don't you? Mm-hmm. Look how thick. And you with the chapter you had, maybe it talked about last week. Doesn't it talk about how the nails thicken and become yellow? Yeah. I mean, this is sort of exaggeration of it, but you know, you need to see these things. The hair, I can't emphasize enough about hair. We talked about earlier, my hair is very thin. I can just imagine 3 weeks and I might as well just shave myself bald, right? I would be a matted mess. I'm a matted mess as it is from one night to the next when I brush it through. That's why I put it up here so you don't see the mess. I should really cut it short, but I won't. There you go. Fuzzy wuzzy. That's very fine hair, right? Very fine hair. And so what you find is sometimes you have to use some, and they might not be in that book, I'm sorry to say, but there's some tricks to getting some tangles out. I think using conditioner will help bring those tangles out. They do have no tangle shampoos too. Care of the eyes. Guys, take the time. Now, have I personally ever removed a prosthetic eye in my 25 years? I would say no.
Really?
I have never done that. I have never done it. What I do is, it will pop out, but imagine how much those artificial devices cost. They have to be pretty costly, right? They have to have them fitted just so to that person's eye socket. So So, you know, with the assistance of the patient, because it's, you know, it's their, it's like my eyeglasses, their eye, it's a cosmetic thing. They typically know how to maneuver it out. But you want to be safe and have them in a position where it's just not going to drop and
Roll down the hole.
who knows. Right. Same thing with hearing aids, guys. We have patients with hearing aids, and then the batteries inevitably always go out when they get admitted to the hospital, right? So you sort of have to have follow-up with the family members, make sure that if they do need to bring in the hearing aids, or bring in the hearing aids or bring in the batteries to change them out, right? Don't put these in water. Don't destroy, clean them, you know, with common sense, right? Some different special types of baths. This is a picture depicting psoriasis. And what can we do with someone in that state? It looks quite painful. And this guy highly susceptible for sepsis, skin breakdown, right? So you'll see on the NCLEX, and I will say somebody's going to get that question, that's going to have, in terms of a therapeutic bath for someone that may have a psoriasis or these kinds of types of different lesions. What would be the recommendation? And you just can choose one. And the one answer that will be down there will be the coal tar solution. That will be the NCLEX. Somebody's going to have that on state boards. It's the coal tar. They always put that one in there. I've had, in the past years, I'd have students tell me that, what's coal tar for? So I always make sure I add that in there, make sure I emphasize that. Sitz bath. How many have had the experience of having a sitz bath? I've had it for during pregnancy or post, right? And also I succumbed to hemorrhoid surgery. You know, because pregnancy and it leads to hemorrhoids. So I had a hemorrhoidectomy because very soothing. This now, see how that thing's sitting on the commode seat? That's not where the sitz bag would be. They would have a hook in the hospital bathroom that would be hanging from, and it's basically it reminds you of like an enema setup, right? And it's a warm solution, and it filters through right there, and then the tube is inserted through a slot right here that shoots upward. And this would hang on a wall right here. The bag would hang on a wall. Very, very needed in the maternal newborn. You guys will learn all about how to use that, prepare that for your new moms, right? I go back to the dental, the oral care, because you're going to see this in the hospital. You may see it in the nursing home, but I guarantee they've already got scheduled dental appointments. But in the hospital, these people come and because here's the thing, here's what I want to share with you. And I like that we're trying to get universal health coverage. I think I do like that. But where is the discussion going on about universal dental insurance? I even wrote one time, as this stuff was unfolding, I said, let's don't forget about the dental insurance. That's big, because really, when you have an abscess tooth and you have a cold, an abscess tooth or a cold, what is going to cause you the most, it's going to drive you crazy?
That abscess tooth.
The abscess tooth. You have individuals, elderly. Think about this. You have elderly that have dry mouth syndrome and they're unresponsive. Maybe they had a CVA and they're sort of in a vegetative type state. I know there's people like that exist in the United States. They're in these nursing homes, right? Vegetative state. And they go in and out of the hospital at intervals as related to sepsis. I mean, they might do mouth care on their patients, but every so often they have to go in and out of the hospital because they have developed some sort of sepsis. Generalized sepsis, they say. But yet they might have some condition like that. Do you think that that could be what the sepsis is related to? I think it could. I really do. Dentation, guys. Dentation. Milk teeth. Education, very important, maternal newborn. It's not even, we're not there, but the concept of making sure that you teach your new mom and dad, don't put that baby down with a bottle of milk. Milk tea. It's all sugar, it's pure sugar, and it's just sticking. See what I'm saying? You know. Oh, it just rots them out. They got decay, and then they have to have, it's major dental for a young, a 2-year-old or one and a half year old. See, can you imagine? No wonder they don't like to go to the dentist, right? I do. I love it. I love going to the dentist. That's my favorite thing is going to the dentist, to have my teeth cleaned. I don't go get my hair done or my nails done. That's my thing, is when I go to the dentist, I pay extra because the insurance will cover for twice a year, but I do a third one, and I pay that out of my own pocket. Because I so enjoy getting the dental hygienist to do such a thorough cleaning. That's my luxury. That's what I love. I feel like I've died and gone to heaven when I go. See, I look forward to my dental appointment. It's the dental hygienist, though, really. That's what I look for. This, the middle picture, it depicts, and you might see this. This is related to someone that might be on something like some sort of anticonvulsive, such as Dilantin, and they call this gingiva hyperplasia. And the overgrowth of the gum lines. You can see that, right? And that is a side effect that you see. But you must have, you must acknowledge that, and you must have meticulous care for their gums. They have to have the anticonvulsive medication. That's the one that works for them to keep them from having seizures. But so you must have an acknowledgement of maybe they need to have more oral care provided, rinses, and
How would
then
you take care of that?
you rinse. Well, you have them. I know it's overgrowth of the skin cells. And you just have to acknowledge that they have to use a very soft toothbrush and frequent rinses and very routine. Maybe that person would be one that would have the visits 3 times a year instead of twice. See what I mean? But there's side effect that can happen. See, medications, they do create some side effects, don't they? Okay. Some common now, we talked about halitosis is actually, it's an impact of some sort of decay going on, right? Dental caries. Got to do flossing. Floss your teeth, guys. Save your teeth. Gingivitis, periodontal disease. Pyorrhea is one of the major causes of tooth loss in adults 35 years and older. And you'll find when you have these patients, they come in from living on the streets. They come in code 3, they're found unresponsive, they're septic basically. That's what I see. I used to see that so much over and over. I worked downtown Baptist in the ICU. We get a lot of homeless John Does in the ICU. That medical intensive care, you get everything. We'll just send it to medical intensive care. Because we take care of any critical sepsis, respiratory, and then the patients in the SICU that have developed a septic state. Denture care. You guys be very careful tomorrow. Those that's got patients who've got dentures, you make sure that you lay down the paper towel, just like in the books, you know. Lay down paper towel, be very careful, have them put their dentures in their denture cup, and then you take it over and clean them, you know. Use gloves, right? That's common sense. We wear gloves when we do our baths, right? We will put gloves on in the shower room. Yes.
Yes.
Yes. Yes.
Yes, that her husband has like a $30,000 pair.
Oh, you better be careful.
Oh, yeah, Dr. D.
30,000.
Yeah,
30,000. I can imagine that's some.
that's a car.
That's almost as much as what I pay for my house.
Well, she said they were really like 100 and something thousand, but since they went to the UT dental school or whatever, that they.
I've never heard of a pair of dentures costing that
That's
much.
what she said. That's what she said.
Well, Dr. Diaz,
She said they gave
it's
her a
implant and everything.
Oh, implant. Implant?
That's the reduced price.
They have no idea.
They're implant retained dentures.
Yeah, the implant
They have
retained
implants in
dentures.
his gum and they retain the denture so they don't just flop in and out.
He don't have to use that
Wow.
that dent stuff. What is it?
Be careful.
Future dent? Yeah, probably dent.
Be careful. You- That should be a show and tell. She should bring him. Right. Yes. Yes. Okay. Again, while you're doing your shower bath tomorrow, what's the site? Can you open your mouth? I just want to see how your mouth is, you know, and because granted that in the morning when we get there, most likely they'll already be starting to get up, and you'll ask them, the CNAs, what do we need to do any mouth care? Because usually they'll have them do their mouth care after they eat breakfast. I'm one that likes to brush my teeth before breakfast when I first get up. But a lot of them, they're trying to get them up ready to go to the dining hall, but you'll want to follow up, say, let me do some mouth care. And so you'll have things in that shower room. See, say, can I do some mouth care for you while you're getting your shower? Doesn't that make sense to you're sort of in there and you do these things? It just makes sense. Here's something interesting. Somebody that might be in a coma or somewhat unresponsive state, you'd want to have them on a sideline position because why? Aspiration, Brian says. Yes, yes, yes. Here's another interesting thing, and we used to use these a lot. Now what they provide you is these little green spongy things. You see those in the lab, don't you? But years back, especially when I first started, it was the common thing. What we used is these lemon glycerin swabs. They'd be in these little full packets. And we'd actually make them soothing, but we'd put them in the freezer part of the refrigerator that we have up in the ICU, you know. And so see how research helps us to know what we should not be doing. So now we don't use lemon glycerin swabs because they actually were a drying agent. And that cause, because you know, if you eat lemons frequently, you know, it does take away the enamel. But see, back when I started in '84 as an LVN, that was the going thing, lemon glycerin swabs. We had to have lemon glycerin swabs, right? We don't use them now. Research says no. It actually dries out the mucosa and causes enamel breakdown. Same thing goes with hydrogen peroxide. We used to make a little mixture of peroxide and a mouthwash. And we learned through research.
I got in trouble with the baking soda.
We learned from research. We gently children's toothbrushes, guys. I use a child's toothbrush on my teeth. It's very soft. That's what you get your parents. Get them to be using the children's toothbrush, but very soft bristles, right? Gently floss. Now there might be conditions that are contraindicated for flossing. We don't actually push the flossing like we should in hospitals because I guess it could become a liability, I suppose. Somebody's on Coumadin, for instance. We're too rough with the gum. What do we bleed? You know, bleeding times. Yes.
Sorry to kill you with book quotes, but
Yeah.
the book is saying, NATI is saying to use hydrogen peroxide.
No.
So
We did have a
Go with your
question on one of
notes.
our tests about.
Go with my notes.
What was that? To use hydrogen.
Yeah, dilution, right? And this volume 2 saying the same thing. Go with your notes.
Go with my notes.
For your test, but for the NCLEX.
Go with my notes for the NCLEX too. Hydrogen peroxide, it's like this, we used to, yes, it's an irritant. We have learned through research because hydrogen peroxide can alter the flora in our body, because in our mouth we have a flora, correct system. It can actually alter that pH. Yes.
Well, when I was younger, I lost my doctor, my dentist was telling me to do a solution, a
Yes.
mixture of it. You just do with that and then spit out.
Yes, and
So
I
we're
know.
not to do that?
No. The research is telling us we could be causing irritation to our mucosa. Just like the lemon glycerin swabs. We used to use those. We used to use them. And we don't use them anymore because of that. You guys don't see lemon glycerin swabs in the lab anymore, do you? No. You see just those green spongettes, right? To dip them in water.
Do the creamers have stuff in them, or
No.
is it just water?
Nope.
You just
Just, they're spongettes.
It's just a
soft
sponge on a
spongettes.
stick.
Yeah.
That makes sense. Just a sponge
Yeah.
on a stick.
But we learned through research. I'm not saying down the road they might come up with something newfangled, you know. But we learned through our research what we should be doing. It's just like patients that were mentally ill back in the 1940s and 50s. And they did experiments. What they do, they put them in an insulin coma. They would inject them with lots of insulin. They thought that would help them. Or they did lobotomies. They did one with, President Kennedy's sister. Their father thought that was the new cutting edge of research. And thus, they thought that would help her. She had I don't know if she had mental illness or she had Down syndrome. But some physician convinced President Kennedy's father that this is the new cutting edge and this will help her. And he let them do a lobotomy, you see, on her. And of course that just really made things so much worse. But removal of the part of the brain. Yeah. See what I'm saying? But that's what happens. We find, and then we learn later, you know. So sometimes, and you'll see swings with research too. There's lots of argument of different things, I will tell you. It's just the way it is. Just like years ago, it was commonplace to do lemon glycerin swabs for everybody. But now, what we do is we get the soft bristle toothbrush and we gently brush up and down, because while we're removing any kind of food particles. See, not that they push as much in these real sick ICU patients to use toothbrush.
Just water.
You could do sponge with water.
Water.
Avoid the lemon, don't do the lemon glycerin swab.
Have you seen those little toothbrush things that have the toothbrush inside the little?
Yeah, I have seen those. Those are sort of neat, right? They are neat and convenient. You can pack them in your purse, right?
Little whisk.
Yeah,
Give 'em to
those
my
are pretty
daughter.
nice, aren't they? In a pinch, they'll do, won't they? Okay, patient environment. I say again. It's always pleasant to have an uncluttered room versus a cluttered room. Don't be that nurse that wants to hoard everything, bring all these supplies, and then you don't use half the supplies bring in and then you leave them. Of course, you have to. You can't take them back once you know what I'm saying. Especially in an isolation room, right? Controlling the room temperature. You guys may find that nursing home might be quite warm. But it's not to serve our purpose. It's their comfort. So you'll find frequently, man, this place is hot. It's for the patient's comfort. That's what it's all about. Let's don't be laughing and joking. Let's be professional. Let's don't be joking around and goofing off. You know, we're professionals. We're here to learn how to take care of patients and residents, and we need to be a professional in what we do. Bed making. Don't forget, you guys are going to be responsible for your beds, and you're going to love it tomorrow. You're getting them up in the shower, so do you need to make an occupied bed? No. Make that bed unoccupied, right? Does it make sense? Let's try to work smart.
Not hard.
Yes. And now, I wasn't sure if Miss Algazay, but I'm pretty sure she probably put up a blueprint, did she?
Yes.
Okay, but I wanted to at least provide you my part. So I did, just because I didn't know when she might put that up. But keep in mind, she selected a certain number of questions out of the exam that I provided her, because I made up my portion first, and I gave it to her. And she told me, well, I'm not going to be having that many question items, because you see, I said 20, didn't I? Yeah. I think she has a portion of 9 or 10. Is that correct? Anybody that's reviewed hers? Because I haven't looked at hers. 40, and did she give out of my chapters about 9 or 10? Yeah. Right. So I have no idea. I'm going to tell you, I have no idea what those questions are that she picked.
For your section?
For my section, but she, out of that section, just study all that I've covered. Does that make sense? It's all
Why you didn't give her
important.
the questions?
Huh?
Why you didn't give her the questions?
I did give it to her, but I made mine up earlier. I had no idea what the number of questions were going to be on her exam. She's the coordinator. I gave her 20 items. Out of that 20 items, she picked 9 or 10 or something. She sent it to the print shop. You see what I'm saying? I have no idea. I don't worry though, because I know I've covered my content. See, I know that you guys have my content, and you have my part of that blueprint, and now my blueprint here should also be incorporated in her blueprint. Is that, do y'all concur? All right. So now it comes to the last bit. You guys break up in your groups, take you a break. And if you, I'll be up front if you have any questions for anything. I will let you know that my office hours are going to be, I've got to leave here by 2 o'clock today, because I have to meet with Trinity Baptist Church for a clinical that's coming up in the winter that some of y'all might be involved in. Today's my meeting with the pastor. So I have to leave here by 2 o'clock because I got to be on time for my meeting with the pastor. And so I understand if you guys need to meet with me on anything, then y'all please come during your lunch break. So you guys take your break, and these are the things that I want y'all to do. Oh, these are final instructions. This is your exercise I want you to do for your think tanks. There you go. Not too many. And then once y'all finished them, y'all are free to depart. And when the last group finishes, then I'll walk out of this room. Any questions? I'll leave this one up. This is the... No questions? I'm going to cut the lights on. Y'all take a break and then break up in your groups. Tell me.